Many people in general grow up thinking like, oh, I can't wait to have a family. And then when you're suddenly faced with not being able to do that, you feel like your body's failing you in a way. And maybe you did something wrong when truly it's not anything that we're doing wrong. Oftentimes it's just a matter of, there are many reasons people are diagnosed with infertility, but oftentimes if we're over age 35, it can make it a little bit harder to get pregnant. Or let's say our thyroid is off, like that can make it more difficult to get pregnant. So it's not something that you're doing that causes this, but certainly people place a lot of blame on themselves. And that can take a huge emotional toll, not just on feeling down about yourself, but it can affect your relationship with your partner, with your family, with your friends.
So welcome to a special episode where we're with Dr. Brynn Wilson. She's a fertility doctor who also has walked the path herself. So today's format's going to be a little different, where we're going to hear Dr. Wilson's story and then kind of help identify the best ways that she could share it with the world. So welcome to the Med Story podcast, and welcome, Dr. Wilson. So excited to have you on.
Thanks. I'm happy to be here today.
So let's dive right into it. I want to ask you is, when patients talk about their experience with Dr. Wilson, what do you want them to say?
Yeah, I think that's a great question. I mean, ultimately, I think the biggest compliment I've ever received from a patient of mine is that I really helped educate them and break complex concepts down into pretty digestible and bite-sized pieces of information for them to understand. So I think hearing that I helped explain things very well is probably the best compliment that I can receive. And I love being remembered for that, for being able to meet people where they're at and really just break things down.
I will say that I think that is one of the most important skill sets that a doctor can have in their toolkit. And I honestly mean that, because you went to school, you've learned all this information, but if you can't communicate that with your patient, it's almost worthless. And is this something that you've actively worked on, or is it just kind of come naturally to you?
Yeah, I mean, I think you're absolutely right. We spend so many years in school learning this medical jargon, right? So we learn how to communicate with other physicians, with how to document things on the electronic medical record, making sure we're kind of covering our bases, so to speak, from a legal perspective. So we have to make sure that we're able to talk the talk. But I think what's really lacking in a lot of the way that we teach our medical students is how to break things down. And I think part of that is just learning on the job how to do that, and responding to patients' questions, and just kind of learning, oh, maybe I should have phrased that a little bit differently. Let me try this time with the patient, or just by learning by kind of trial by fire, I guess. And you really do learn a lot from your patients each time. So when I go into talking to a new patient about their fertility or their desire to want to freeze their eggs, a lot of that time that I spend with that patient is just educating them about their menstrual cycle, about the reasons why we're even talking about freezing eggs because of age-related fertility decline, and all of that. So I think there's a lot that goes into just really educating our patients, and you learn a lot from trying and failing, frankly, and then learning how to rephrase things in a way that's a little bit more digestible.
So how do you know if they're actually digesting the information? Are you looking for certain body language cues, or do you actually teach back? How do you know?
Yeah, I mean, I think, I haven't perfected it fully. Obviously, this is still a learning progress or learning process for me as well. But I think, yeah, having them repeat things back to you, or say like, oh, I didn't realize that going through egg freezing doesn't make me go through menopause sooner. And you're like, oh, well, let me take a step back. Or somebody, I think one time, was surprised to learn that sperm and egg actually have to meet in the fallopian tube. So then we kind of get out the model of the uterus and fallopian tubes, and we talk through how ovulation occurs. And so sometimes it's just by hearing patients' questions and then responding to those. But yeah, having them kind of talk back to you and say, yes, I understand that I need to get my hysterosalpingogram done to make sure that my tubes are open, because that's where sperm and egg meet. So I think it's a little bit of kind of asking to make sure that they understand. But then sometimes you just learn that in the follow-up questions that they have for you.
For sure. And so what do you think is going on in the head of a family, whether it's the woman or the husband, when they're either seeking or going through fertility treatment?
Yeah, I mean, I think it's really daunting. Most people growing up, they spend, I guess I can only speak from the female perspective, but you spend the majority of your life trying to prevent pregnancy. And then at a certain point in your life, you're suddenly like, okay, well, now I'm ready to have a child. And we sort of expect that the body should just snap right into that and be able to get pregnant. But it's actually much harder than we make it out to be when we're like in high school sex ed, for example. So I think it can be very daunting and very frustrating for patients by the time they are trying to build their family. And it can be pretty intimidating to have to talk to a third person about wanting to build a family where you thought that maybe just you and your partner were going to be able to handle this on your own. So I think it can be intimidating to walk into a fertility doctor's office to have to kind of explain where they're at. But I always remind my patients, like, this is very common. It's up to 1 in 6 people are diagnosed with infertility. So A, it's really common. B, it's actually not that easy to get pregnant. A lot of things have to work out in the exact coordinated, sequence of events in order for a pregnancy to establish. And so I try and remind my patients, A, they're not alone, and it's actually more common than they think. And I'm happy to kind of troubleshoot with them to figure out what puzzle piece is missing and how we can work through that to build their family. So I know it can be very intimidating, but I'm here to kind of break it down and make sure that they know that they're not alone.
So talk to me about the emotion that's going on to them. Because yes, I understand they're frustrated, but I imagine there's almost emotions of guilt and loneliness throughout this process.
For sure. That's a very common, and there are increased rates of things like depression. There have been studies that have shown that getting a diagnosis of infertility can be as life-changing as getting a diagnosis of cancer, which I'm not saying that I'm out here treating cancer. I'm here to help treat infertility. But, it is really devastating to get that diagnosis because many patients or many people in general grow up thinking like, oh, I can't wait to have a family. And then when you're suddenly faced with not being able to do that, you feel like your body's failing you in a way. And maybe you did something wrong when truly it's not anything that we're doing wrong. Oftentimes it's just a matter of there are many reasons people are diagnosed with infertility, but oftentimes if we're over age 35, it can make it a little bit harder to get pregnant. Or let's say our thyroid is off, like that can make it more difficult to get pregnant. So it's not something that you're doing that causes this, but certainly people place a lot of blame on themselves. And that can take a huge emotional toll, not just on feeling down about yourself, but it can affect your relationship with your partner, with your family, with your friends. You get another pregnancy announcement, that you're scrolling through social media and you see another pregnancy announcement. It can be really hard to keep seeing that over and over again. So it definitely takes an emotional toll. So knowing that my patients are already walking in the door with those emotions is super helpful for me, just to be able to say like, look, I know that this is not easy, but how can I partner with you to work through this with you?
I think that's so important. And I really want to identify this because if someone comes in, especially in as an emotional experience as going through a fertility treatment, oftentimes when we're making decisions and we are in a high emotional state, when someone tries to come at us with logical reasoning, we're not so receptive to that, at least in that current moment. And that's when I find that actually sharing story can be a really powerful way because it helps them understand that either you've treated this before or you've been through it yourself. And that can bring a tremendous amount of comfort to that patient. And so I want to dive into your personal story because we had talked before this and you said that you've gone through egg freezing yourself. Can you kind of explain to me what that evolution looked like?
Yeah. So when I was in my OBGYN residency, I was interested in pursuing reproductive endocrine and infertility fellowship. And so I was working with a local REI clinic or fertility clinic. And I was like, well, I want to check my AMH hormone, which is a hormone that measures as a marker of your ovarian reserve. And I did my AMH when I was, I think, 29 and found that it was lower than average for the average person my age. And there's a couple of reasons for that. Sometimes it's just bad luck. And sometimes, for me in particular, I was diagnosed with Graves' disease when I was in med school, which is a thyroid disease. That's an autoimmune condition. And so I made autoantibodies to attack my own thyroid hormone. And as a result of that, one of the treatment options for that is radioactive iodine, which is the same treatment as for thyroid cancer. And so you take this radioactive pill, it destroys your thyroid, and then you have to be on thyroid supplementation for the rest of your life. One of the side effects of taking that medication is it can actually impact your ovarian reserve. And so they've done studies that have people that have been treated with radioactive iodine, their AMH or their ovarian reserve goes down. So it did reduce my overall fertility. And that was actually not something that I was counseled on when I was in medical school and being treated for that, and something I didn't actually learn about until I was a fertility fellow which is interesting. But regardless, my AMH was low. So I checked my fertility, so to speak. I mean, the only true test for fertility is trying to get pregnant. But what I will say is there are markers for ovarian reserve that you can check. And one of the ways that you can check that is with a blood test, the AMH hormone, and with an ultrasound. And so I was curious in med school where I was, and in residency is when I got that blood test done when I was 29, and found that I was lower than average. And I'd been dating somebody that things were getting pretty serious, but wasn't ready to build a family by any means at that point in my life. And so knowing that my reserve was on the low side and I wasn't ready to have a baby that year or the next year, or conceivably for the next 5 years, because I wanted to work on my career and finish residency and go through fellowship, et cetera. So knowing that, I looked into the process of freezing eggs. And interestingly, I had zero insurance coverage for this. This was all out of pocket. And as somebody on a residency salary, you're not making much more than you can just pay the rent and for food and maybe a gym membership, and that's pretty much it. So freezing eggs was definitely a huge cost and something that took me some time to pay off, but I will talk about the reasons why it's important to freeze in your 30s if you're in this situation. But yeah, so I took the next step to try and get a consultation and figure out what the process would look like. So it was interesting being a consultation and figure out what the process chip in fertility medicine, but also being, I'd go in for the ultrasounds in the morning and I'd be like, oh, I wonder how big my follicles are today. And I wonder what my estrogen level is. And should we go up on my medication? So it was a really interesting process, both from a patient perspective and now a fertility doctor perspective of going through that journey. And I learned a lot from the patient perspective. You learn what it feels like to really be bloated, to understand the workout limitations that you have to have during the period of time in which you're doing the stimulation medications, because your ovaries go from being about the size of a walnut to being small oranges. And so when they get to be enlarged, not only do you feel that in your pelvis, but you also need to reduce your high intensity exercise. You can't go on runs like I normally like to do for stress release and things like that. So you learn kind of all of the limitations and what it feels like to go through the process. And I learned that certain medications burn a little more than others when you inject them. And so these are conversations that I have with my patients now. I'm like, hey, so this is what you should expect when you freeze your eggs. You're going to feel bloated. You're going to feel tired. You can still go to work, but you can't go to your Barry's boot camp class. So maybe take a break from that for a few weeks, but you'll get back into it when you're done. So it's nice to be able to have these conversations with my patients to be like, yeah, I know exactly what that feels like. The recovery's not as bad as you might expect, knowing that everybody's experience is different, right? So maybe one patient may have, a tougher recovery than I did or something like that, which is certainly valid. And we talk through all of that. But having been through it myself, I definitely can relate and talk them through kind of what the expectations are.
It sounds like going through that experience has probably made you a much better and more empathetic doctor. And it sounds like you've learned a lot, but tell me, what were you feeling during it? What were the thoughts going on through your head? It sounds like you were like, oh, this is cool, but there must have been some anxiety producing motion as well.
For sure. Yeah. I think I also, when I'm talking through what to expect with my patient, I do remind them that this is an emotional roller coaster, because every time you come in, you're thinking like, oh, I wonder how many eggs I'm going to get. And if that number is not as high as you want it to be, which frankly, it never is. I mean, we would always want to have more eggs than we ultimately are able to get oftentimes. So I remind them of that. But yeah, I think it is an emotional roller coaster. There's a lot of expectations and hope placed on this process. You are literally putting all of your eggs in one basket to hopefully fertilize them down the line and build your family, which a lot of us hold a lot of emotion and expectations in terms of the future families that we want to have. And knowing that none of this is a guarantee is also very important. So there's a lot of expectation management that goes into kind of the counseling that we talk with our patients. But yeah, personally going through it, I was super bummed with the outcome of my first egg retrieval. I ended up with like half of the eggs that I was expecting. It was really tough. I had a conversation with my doctor like later that night, and I was in tears about how come I didn't get more eggs? Like, what can we do differently? And now when I have those conversations with my patients, I'm like, look, I get it. I know how it feels to not get as many eggs as you were hoping for. And this is what we can do differently this time. This is what we learned from this cycle. And obviously we never hope that that's the case with the first round of IVF or egg freezing. But the reality is you don't really know how your body's going to respond to these medications until you try it. And there is a little bit of art that goes into it in terms of figuring out how we can optimize things the next time around. And so I definitely know how devastating it can feel when you wake up from anesthesia and you're like, wait, I only got that many eggs. How did that happen? And I definitely know what it's like from the patient perspective, and also sitting on the bedside with my patient after a retrieval saying, hey, we only got this many, but this is what we can do next time. And this is what I think happened. It's not my favorite conversation to have, but I definitely know, unfortunately, it does happen on occasion. Thankfully, not all the time. But when it does happen, I definitely know how painful it can feel.
Wow. I give you so much props for being willing to share your story with your patients, because I imagine once they hear that you've gone through it, that is only going to strengthen that connection. And so when you were going through it yourself, you said you were on the phone with your doctor crying. So your doctor was your mentor. How did they respond and how did they help you in
Yeah.
that process?
Yeah, I think part of it is like, okay, well, today you had anesthesia, so let's like take a minute and take a breath. Let's sleep on it, and then we'll regroup and we'll talk through kind of pros and cons of maybe going through another round. And I ultimately did end up going through 2 additional rounds of egg freezing, just to feel like I had enough eggs in the bank, essentially, since I haven't started building my own family yet. So yes, I think having that conversation with them, just talking through the logistics of like, okay, well, what could we have done differently? What do we think happened? Was super helpful for me, who's somebody who's type A and likes more knowledge and more information about things. It helps me kind of cope with understanding like, okay, well, why did this happen and how can we change things the next time? And that's not for everybody, right? But some people do want that information. And so that is something that I definitely chat with my patients about. I'm like, hey, do you want to talk about it right now, or do you need a minute? Do you want to sleep on it? Do you want to let's schedule a follow up in a few days? Let's talk through it and talk about what we learned through this. Because truly, when you do go into, let's say, another round of IVF or egg freezing, it's not that cycle was lost. You actually learned a ton of information. And for me, just in egg freezing, I learned how I responded or didn't respond to a certain trigger injection. There's like little nuances here and there that you learn about the body and how it responded to those medications, and then you can take that knowledge and move forward. So it's not a failure, it's just a learning process. And unfortunately, sometimes it does take more than one round to learn that. But yeah, I think that is one of the things that I try and bring to my patients is knowing that like, hey, this wasn't a failure. We did learn a lot from this cycle. And also if they're making embryos, for example, that is also something that we learn a lot. Like, was there an issue with actual fertilization? Was there an issue with them making it to the embryo stage and maybe they failed on day 3 or 5? So learning that along the way is helpful in terms of providing clarity to what went wrong.
I love having these kind of conversations because I think it's so important that you, especially as an REI doctor, right? You're going to be having patients come to you for these kind of challenges. And you yourself have two main stories to tell. Number one is your own personal story, which is what you just shared with us, where you're actually the hero in this journey, where we have this story work framework. It's called the hero's journey, where in this situation, Bryn is the hero, and she's faced the challenge of not knowing if she was going to be fertile, went through the egg freezing, and then had a guide who was her doctor along the way to guide her along and give her a sense of comfort. Now there's the alternative story, which is now your patient's story, where your patients are the hero. And you get the opportunity to step into the shoes of being their guide and helping them come through it. And telling both of these stories is going to be so, so powerful for you. Because when it comes down to it, what do you want to be known for? Because you just started your career as an REI doctor, but 5-10 years from now, you're going to be world class, right? You already are. But what do you want the world to know you to be world class as?
Yeah, I think it's an interesting concept because when you're a brand new physician, I mean, granted, I graduated from medical school many years ago, but being a brand new, recently graduated REI physician after going through so many years of school, one of the things that is interesting about being a new doc and entering into this field where a lot of patients are doing their research, right? As they should be. They should be looking into the credentials of their physicians. They should be making sure that they have good success rates, that the lab has good success rates, that the clinic that they're at is reputable, all of those things. But I think one of the things that's interesting is this whole concept of like building your brand and what do you want to be known for. And initially, I will say in the medical community, that sort of gets met with a little bit of an ick factor because as physicians, our goal is really to take care of people and to heal the sick, right? And to really meet people where they're at and educate them about their body. And so there's an element of where do you take your career, especially in the era of social media and people really trying to, there are a lot of med influencers out there, which I think they're doing a fabulous job of combining patient education and sort of bringing their authentic selves online, which I think is really admirable. And I think there's an element of what I hope to do is to do some of that, but truly it's not so much that I did not go to medical school to be an influencer. This is it's not in my personality to just, obviously there are many other ways to become an influencer. You don't need to go to medical school for that. So I went into medical school to take good care of patients. And so ultimately what I hope that my career trajectory will take me into is just really focusing on patient education and advocacy work. And that's one of the things that in the field of fertility medicine, there's a huge need for increasing access to care. And so that's something that I personally continue to work on. I work with this organization called Resolve, which is a nonprofit that works on expanding access for infertility treatment to patients, because unfortunately, the fertility field has sort of become this interesting intersection between privatized medicine with a lot of business mindset approach and medical treatment, right? So we are providing a service for a medical condition, which is infertility. And so it's a very interesting intersection of medicine and business. And so I think my goal is really to continue to educate patients, continue to expand access to care through advocacy work by meeting with legislators and talking through the reason why we need IVF to be covered by insurance companies, because this is a medical treatment for a known medical disease, which is infertility. And so I think that that's something that I hope to continue to do with my career, whether that is through meeting with legislators and doing kind of that type of advocacy work where I'm chatting with people about how to tailor their build. I'm not somebody, that's not my forte, right? I didn't also go to school for learning how to do that. But I think by seeing patients that don't have access to care and have like a financial limitation to get the treatment that they need, that is something that I see every day and is very frustrating, and something that I continue to try and work for my patients to have expanded access to care. And then education. I think that is one huge other pillar that we're lacking in terms of in high school, we talk a lot about how to prevent pregnancy, but we don't talk in college or med school or things like that about how difficult it can be to actually get pregnant. And so oftentimes there's a huge delay for patients to come in and see us. And time is really our most valuable resource when it comes to fertility and just in general in life. So I think it's something that it's really important that we work with our community about advocating for increased access and also educating people earlier on about the importance of if they're having a hard time getting pregnant, coming in to see us. So yeah, I think ultimately my goals in my career would be to continue to work on expanding access to care and educating patients, whether that's through, podcasts or through social media or through just my day-to-day interactions with patients. That's truly what the goal of all of this is.
There's so many different avenues for you, and it really is a really powerful goal for you. I agree, like advocacy, especially if you can find ways to help change the curriculum so that we're actually taught properly what the risks versus the benefits and things to look out for, rather than just like the pure abstinence, stay away from it. It's the worst thing in the world, right? And finding ways to share that. What I find interesting though, is that you say patient education, which is obviously so important, but we are now in a day and age where education and information is more accessible to us more than ever before. So every girl that's going through high school now has ChatGPT on her phone and she can search this stuff, right? And so what role do you think you sharing your expertise versus her using something like AI, or how can those come together?
Yeah, I mean, I think AI is an amazing tool, and like, what an amazing time to be growing up. So much information at our fingertips, and being able to learn, yeah, a lot about just the body and everything. I mean, I think a lot of us would have loved to have had like a quick chat GPT when before Google came into existence. I think it's what an amazing time to be growing up and being able to learn. So I think what we can provide as physicians and things like that is really trying to tailor that to that individual person. I think every patient that comes through the door has different needs and different expectations about what their goals are for their family building journey, and really trying to tailor all of this dense scientific information to specifically figure out what is going to be the best course of action for them individually. And also, ChatGPT hasn't frozen their eggs before, so they also can't say what exactly it feels like. They can probably give you a nice list of possible side effects and things like that. And what a great tool for that, right? But I think there is an element that is so human about meeting with your physician that you need to feel connected with somebody, because this is such a personal thing, right? This is arguably the most intimate part of somebody's life is working to build a family. And being able to have a one-on-one conversation with a patient, I think, will never be reproduced by AI. But I do love AI as a tool to, work with education and continue to help kind of guide patients in the right direction. But I think that human touch piece is still necessary.
I agree. I think that really the ideal intersection is not so much to provide more information to the patient, but to provide the right information at the right time. Because it's really systemizing the organization or the information so that you can say, here is exactly what you need to know in order to be informed to make a good decision about what the next step is in this journey. Because if you go and you look this stuff up, it's going to give you a million different options. You're going to end up developing a ton of health anxiety, wanting out all the possibilities. And that's where actually seeing your doctor be like, hey, it's going to be okay. Let's focus on actually what's important here. And then maybe even start sharing some story with it too, to make it human, to say, I've been through this before. I've treated people like this before. I think that is
Yeah.
where the beautiful intersection between the AI and then the patient or the doctor interaction is going to be. So I think it's going to be an exciting future.
Yeah, I'm excited too. It's good.
So now as you grow out your practice, if a woman is like, wow, Dr. Bryn sounds awesome, I would love to get a consultation with her or reach out to her, what is the best way to find you?
Yeah, I mean, they can find me through Googling me, of course, but I am on Instagram at Bryn Wilson MD. And I also practice at San Diego Fertility Center, which is back in my hometown. So grew up in San Diego, and I'm thrilled to be back home, close to family, and being able to work and serve the patients here. And we also work with patients from all over the country, all over the world. We have a huge international patient population too. So happy to, yeah, touch base with patients and talk through how we can help you meet your goals. But yeah, mostly Instagram, or you can make an appointment with me through our website.
In the meantime, before they do reach out to you, right? What do you want that woman to know that is either thinking about getting fertility treatment or currently going through it?
I think knowledge is power. So first and foremost, understanding your body is super important, right? So whether or not if you have regular menstrual cycles is really helpful. So just knowing your own body and kind of what your experiences are with your periods. So for example, if you have really irregular periods, that's actually not normal. So understanding why it's not normal could be a key to understanding your fertility and your overall health. Also, understanding that your fertility is a finite resource. So I don't want people to wait too long and delay just because they're maybe nervous or want to wait until their 35th birthday to kind of address this. I do see a lot of patients kind of putting this off, and it's important to put yourself first. Sometimes I know a lot of us focus on our career for a lot of time and focus on our relationships and pour so much into that, but also just remembering what your overall goals are for this one life that you get. So if you do want to be a parent and that is a priority for you, don't put yourself last on your to-do list. It's important to remember that if being a parent is ultimately your goal, then addressing things sooner rather than later as in your best interest.
I agree 100%. If you want to be there for the people around you, you got to take care of yourself first and foremost and your needs. Oh, well, this has been a really awesome conversation. I appreciate you being so transparent, being willing to share your story. And I know that a lot of people hearing this are going to get a ton of value. So thank you so much for taking the time to sit down with me.
Of course, happy to be here.
And so if you are a healthcare provider that is trying to step out there and build your own brand, maybe you're building your own business and you just have a story to share, make sure to reach out to us at medstorymedia.com/podcast. Apply to be a guest. Until then, we'll see you in the next episode.